Good day, ladies and gentlemen. Welcome back to the NCLEX Nurse Mechanic. On the last video, we discussed cardioversion. That was part one. And remember, because I said that I realized that you don't like watching long videos, we're going to have part two, which is going to be your defibrillation. The main aim here is to be able to differentiate between cardioversion and defibrillation. And as usual, remember we have our blank page where we are going to write on. Let's get right on it. Remember now, just a quick recap. We spoke of your cardioversion, where we said that it's used for abnormal rhythms. We are correcting the abnormal rhythms. We only use it when your patient has a pulse. Minimum will start from 50 joules to 200 joules. Now, coming to defibrillation, let me just write it here. Coming to defibrillation. With your defibrillation is used on a patient without a pulse. Your patient does not have a pulse. And why are you defibrillating? It's because you want to establish a pulse, or we can say you want to establish a heart rate. And there are two ways of defibrillation, or there are two forms of defibrillation. You have the monophasic, you have the monophasic. The monophasic, this is where you use 360 joules, even though it's outphased. But for the purpose of NCLEX, sometimes they do ask you, because they want to see if you can differentiate between the monophasic and the biphasic. The second one being the biphasic. Biphasic, we start from minimum 120 joules, maximum 200 joules. Remember, when we talk about defibrillation, when we talk about your cardioversion, we are shocking the patient, isn't it? Also with your defibrillation, what are we doing? We are shocking the patient. When it comes to your biphasic mode, most of the time they like giving you a scenario. There is a patient, and then on the screen you see that there is a systole, right? And then you must defibrillate, right? How many joules are you going to use? They can give you 50 joules, 120 joules, 200 joules, 250 joules. Remember, we start from 120 joules, maximum is 200 joules. So if you are given 120 joules, you are given 200 joules, remember, you always start with 120 joules. So what is the option that you are going to choose? You are going to choose 120 joules, isn't it? And as much as I said that, defibrillation is used on patients without a pulse. And what kind of EKGs must we be looking at, right? For an example, your patient who's presenting with your pulseless ventricular tachycardia, right? There's no pulse, right? Your patient who's presenting with asystole, that's straight line. There is no pulse as well. If there's no pulse, what must you do? Defibrillation, right? So just to summarize, ladies and gentlemen, like I stated, your cardioversion, your patient has a pulse. Defibrillation, there is no pulse. Cardioversion, you want to correct the abnormal rhythm. Defibrillation, you want to establish the heart rate. The joules that you use in your cardioversion, it's from 50 to 200 joules. The joules that you use in your defibrillation, remember there are two kinds. Those two kinds, you have your monophasic, you have your biphasic. Monophasic, you use 360 joules. Biphasic, you start from 120 joules to 200 joules. I hope that is clear. And I know that most of you might be saying that, but then you are not familiar with the kind of different EKG, their abnormalities, and the management. Not to worry, the video is gonna come along. It's just that I don't want to do a long video where everything is compressed. I know that you get very bored quickly. I'm a student as well. I get bored quickly. But I hope this video, the part two of the cardioversion versus defibrillation, it summarizes everything for you. I hope now you'll be able to identify the difference between cardioversion and defibrillation. Because check this out, even if you don't understand, but then if the scenario says that your patient has a pulse, definitely you're not going to defibrillate, and you'll be able to use your elimination method to say that I'm not sure what this EKG is, but what I'm sure of is that this patient has a pulse. Because this patient has a pulse, I'm not going to defibrillate. What else can I do? I'm going to cardiovert. Thank you for your time, ladies and gentlemen. And please watch out for more videos from the NCLEX nurse mechanics. Please don't forget to like. Please don't forget to share. Please don't forget to subscribe. Have a very, very good day.